Hello and a very good evening to you all. Myself Solu Gautam and today on behalf of Mero Eye team, I'll be hosting this session and I extend a very warm welcome to each one of you who have been connected with us through our iTunes webinar. Well, I would like to thank you all for taking the time out from your heavy schedule and marking our program with your glorious presence. Thank you for joining with us this evening. And also don't forget to subscribe our YouTube channel for being updated to our programs even in the upcoming days. For now, I would like to step forward to inaugurate today's session. And also, I would like to notify you all that we'll be having our discussion session at the end of the webinar. So if you get any queries in between, just drop them on our comment section. We will get back to you later on. Today, we are going to have a very significant session considering the relation between present scenario of the global pandemic with our daily optometric practice. And for that, we not only have a single but two special delegates who will be talking particularly about coronavirus and contact lens wear. Let's welcome Dr. Daddi Fadel all the way from Italy, who is a Dioptom Fellow of American Academy of Optometry and Scleral Lens Education Society, and Dr. Melissa Barnett, all the way from USA, who is an OD, Fellow of American Academy of Optometry, Scleral Lens Education Society, and also of the British Contact Lens Association. I welcome both of you on behalf of Mero Eye Foundation and all our participants, doctors. Thank you so much for your invaluable presence.
Thank you so much for the kind invitation and for having us. It's always a pleasure to lecture with Daddi Fadel, and it's wonderful to see all of you. So moving to the next slide, we are very fortunate to work with many companies to help grow our wonderful professions. And today we have a great topic, moving to the next slide, and very timely, talking about contact lenses in the time of this pandemic. So I am here practicing in Northern California. I practice at UC Davis. And for 10 weeks, we were only seeing emergency patients. And now for 9 weeks, we've been back in clinic seeing patients, and we're going to share some of our different perspectives about how we're working with contact lenses at this time. So back in March, so on March 9th, there was an article that came out actually incorrectly from the American Optometric Association that misquoted the president, Barbara Horn, saying that people should not wear contacts. So contact lenses, even at this time, are actually quite safe to wear. There have been a lot of misconceptions in the media, many articles, even just a few weeks ago, saying that contact lenses are not safe to wear and that everyone should switch to glasses. And now we have to think about that for our patients, our patients who like to wear contact lenses because they offer freedom and functionality. And now that we're all wearing masks, both ourselves and our patients in clinic, glasses really fog up, and that's a significant issue. Everything fogs up when we're doing an eye exam right now. And then we have to think about our patients who require contact lenses for medical necessity and inform them that they also are safe to wear as long as we're following certain protocols. So moving on to the next slide. This was a joint statement that came out from both the American Academy of Optometry and the American Optometric Association. And some highlights about contact lenses, that they're safe to wear as long as you're healthy. So if you're feeling ill or sick or just are under the weather, it's best not to wear contact lenses and switch to glasses. There's also no evidence, and that's a really important point. There's no evidence. There have been many, many publications since March, but there's no evidence that contact lenses that you're more at risk for acquiring COVID-19. There's no evidence that wearing contact lenses is going to put you at risk or that you're going to develop the virus from healthy contact lens wear. And of course, contact lenses provide really good vision, good comfort, and our great peripheral vision that we have as well. So moving on to the next slide. Proper hand washing is absolutely essential. And this has been all over the news and media, I'm sure all over the world, about washing hands and really washing all parts of the hands, the fingers, the front, the back, for 20 seconds with soap and water and drying with a clean towel. Now, of course, proper hand washing is important at all times, and we're all doing it many, many times a day, but especially prior to handling contact lenses. So that's before inserting contact lenses and prior to removing contact lenses as well. Proper care and handling of contact lenses. So for daily replacement lenses, it's really important to wear them daily. I had a patient who came in the other week who was running low on her supply because she hadn't been in for a bit. And she told me, she said, oh, well, I thought about wearing my daily replacement contact lenses longer than one day, but then I thought of you and I knew you would tell me not to do that. And I thought, oh, that was good that she thought of that. And no, you should not be reusing daily replacement contact lenses at all. If you're wearing a reusable, so either a soft lens, say it's a 2-week or a 1 month, or a gas permeable, scleral, or hybrid lens, proper disinfection every single night is very, very important. Making sure that the contact lens case is cleaned appropriately, because we know biofilms can build up on that case and lead to microbial keratitis. And of course, if you're not feeling well, not to wear contact lenses. So moving on to the next slide. So the proper hand washing, and here we have a video as well. So we know that we have to wash our hands, but we also need to clean our glasses, because viruses and bacteria can live on our spectacles. And the studies really range from hours to days, depending on what study you're looking at. But it's important to wash glasses, and that includes sunglasses as well. So this is something that we can educate our patients that it's important to, 1, wash hands prior to handling any glasses, but 2, washing glasses on a daily basis. Next. And eyeglasses do not provide protection. So these are not goggles, they're not personal protective equipment. They just provide, of course, good vision. But we also need to think about those who wear glasses occasionally, say glasses for reading over contact lenses, or sunglasses, or people who put on and take off their glasses. And there have actually been studies that have been done that show that people actually touch their eyes and their face a lot with glasses wear. Next. So during the pandemic, initially back in March and April in our area, and it sounds like in other areas too, many practices were closed and patients really didn't know how to get in touch with their doctors. And we actually, since we were open, we saw a lot of these patients who are coming to us. But we are still during this time, some patients, for whatever reason, don't feel comfortable coming in for an exam right now. Some patients are coming in and they're getting, refit with their contacts or getting their contact lens prescriptions updated. But even at this time, it's really important to have good communication with our patients and make sure that they have an adequate supply of contact lenses, and arrange an exam whenever they feel that they can come in. And in some parts of the world, maybe they can't come in even at this time. So going over even by phone or video with our patients, proper care and handling of contact lenses, replacing daily replacement lenses, proper cleaning and disinfection of lenses, and also just proper practices. Crazy things happen, and I'm sure they happen all over. I have patients who think of alternating contact lenses as the way to go. They have multiple pairs of contact lenses that they alternate. And just to advise them not to do that, to wear one pair of lenses, to disinfect, clean it every single night. Next. So the core group came up with some really helpful information, and I would encourage you to visit the website. This is great patient-facing information as well. about safe and healthy contact lens wear. So washing hands, cleaning lenses properly, that glasses are actually not PPE, and if you feel ill or sick, not to wear contact lenses. So I believe there's a video there, Daddi?
Yeah, I can't run it. I don't understand why it doesn't run. That's okay.
Okay. So you can see the website below, and you can see good videos. You can go visit the website for some good videos.
Okay, here is, okay.
Here are the facts about wearing contact lenses during the COVID-19 pandemic and what you should be doing. The good news, you can keep wearing your contacts. There's no scientific evidence that wearing contact lenses increases your risk for developing COVID-19. Practice good hygiene to stay healthy. Wash and dry your hands thoroughly. Take good care of your contact lenses and lens case. If you wear glasses, clean them regularly with soap and water. Regular glasses won't protect you against COVID-19. Despite rumors, there is no scientific evidence that regular glasses offer any protection. Regardless of whether you wear contact lenses, glasses, or require no vision correction at all, avoid touching your nose, mouth, and eyes with unwashed hands. If you're sick, stop wearing contacts. Use your glasses instead. Resume wearing contacts with fresh new lenses and the new lens case once you're back to full health. As always, if you have questions, check with your eye care practitioner. And for more information, visit covidifax.org.
So that's a helpful video. And one more thing just to add in is replacing makeup regularly as well. So if indeed a patient is sick or unwell, and if they do have or had coronavirus, it is important to replace makeup too. And in general, it is important to replace makeup such as mascaras and eyeliners, liquid products at least every month or every 3 months. Next. This is a recent survey that came out by Jobson, and this just came out actually last week about screening patients for COVID. And I thought that this was interesting because in our clinic, all are being screened on a daily basis. All of our patients are being screened, asking questions if they've been around anyone who's been sick, if they've been sick, if they've traveled, and everyone's temperatures have been checked as well. So I brought this up to see in different parts of the world if things are maybe different. So here you can see on the left, temperature checks. The majority of practices are checking temperatures for all patients. The majority of practices are asking patients prior to the appointment, the screening questions, and then just questions about contact with people with COVID. And a very few are not asking any questions. So Daddi, what are you doing in Italy? Like, how does this differ at all? How are practices in Italy seeing patients?
Yes, we have also temperature checks. We have questionnaires also. Everyone getting in the practice is wearing a mask, and also we give them gloves to wear their gloves because they may wear gloves outside, but we know that they may be contaminated with viruses around. So as soon as they get in our practice, we give them the alcohol soap and they wear gloves, and we start the examination. And also everyone inside has equipment protection, definitely.
So what if a patient has a temperature or if they have been around someone who's been exposed to COVID? What happens next?
We cannot receive him. We take another appointment later until we don't have his test positive or negative. He needs to get in the practice without fever. But you know, we have problems because people can take medications to lower the temperature, so you cannot know if they have actually the temperature or they have assumed some medical to lower the temperature. So it's very, very tricky.
And of course, there are asymptomatic, people
yes, definitely,
who have the virus as well. So moving on to the next slide.
Yeah, it's my turn. I would like to thank for the invitation from my part. It's pleasure to be here, and it's always a pleasure to lecture with Dr. Melissa Barnett. So the main transmission routes of SARS-CoV-2 are respiratory droplets and close contact. There have been several statements related to ocular transmission of coronavirus. Here are some articles on the novel coronavirus, and all these studies have shown that the eye is rarely involved in coronavirus infection. The eye is neither a preferred organ of human coughs infection, nor is a preferred gateway of entry for human coughs to infect respiratory tract. It remains unclear whether all COVID patients with viral conjunctivitis have their virus in their conjunctival sac, or if the virus itself causes the COVID disease. It also has been speculated that conjunctivitis may be a common symptom in COVID patients. Different studies have shown that frequency of conjunctivitis is low, less than 3%. So why contact lenses cannot be related to COVID? We will list 4 reasons. The first one, if the virus adheres to the contact lens surface, it also reaches the exposed parts of the eye, getting in contact directly with the ocular mucus. Even if the virus is embedded within the lens material, the infected droplets got directly in contact with the exposed mucus, penetrate the organism faster compared to those absorbed by lens materials, as these latter takes time to be released by the contact lens material before infecting the organism. So even if the virus is transmitted through eyes, the virus will infect the subject through the ocular mucus, whether they are wearing contact lenses or not. It has been also suggested to switch to spectacles instead of wearing contact lenses, just like as Melissa said before. It has been shown that coronavirus may persist on both metal and plastic for a long period of time. And we know that spectacles are made of metal and plastic. And Melissa stated that before. Studies showed that subjects touch their faces on average 23 times per hour, and 44% of all face touch involve contact with mucous membrane. Spectacles are worn on faces and are frequently touched by fingers and hands. So it's essential to consider that people tend to frequently touch their eyeglasses, to adjust the fitting on the faces, also in presbyope, who tend to remove the eyeglasses and put them again on their faces, touching the frame and the face several times a day. The age of presbyope patient is also at a higher risk to be infected by coronavirus. Spectacles are not protective eyewear. The level of protection is different. Indeed, for this reason, US CDC suggested that personal eyeglasses and contact lenses are not considered adequate eye protection.
Daddi, in your practice, are you disinfecting spectacles in optical?
Definitely, yes. After each patient, when he tried the frames, we put them in one part, and we need to disinfect them before putting them again for trial for other people. Definitely, yes.
Yeah, the same here. And one thing that's a little different is we have appointments now for optical, where we never did before, to reduce the number of people in optical.
Yes, it's a little bit funny because people are intimidated by trying a lot of frames, because they're saying that it's a lot of work for us to disinfect all these frames after that. So they choose very well the frame they want to try, and they try it. While before,
good in many cases, and then they're more decisive.
Yes, less time also, because people before they could try a lot of eyeglasses and confounding themselves, confusing the ideas on what type. Now they are very more focused on the type they want to put. Yeah, that's the good part of the story.
Very good.
So yeah, while wearing spectacles, people tend to frequently touch them, and they are convinced that they have clean hands. They touch their faces, transferring the virus to nose, mouth, and eyes. So it's very important to avoid face touching to prevent transferring the virus to nose, mouth, and eyes. So as you already said, it's crucial to disinfect eyewear, a lot of indication to disinfect eye contact lenses. And we know in the morning, we touch the contact lenses with washed hands. We have a lot of indication about that, but we don't have enough indication on how to manage eyeglasses and how to touch eyeglasses. It's crucial to wash the hands before touching the eyewear, the eyeglasses, or also sunglasses. Applying hand soap on the surface of the frame and lens and massaging gently with the fingers. After, it's necessary to rinse with warm water until the soap has been eliminated entirely. It's important also to dry the spectacles with a microfiber cloth without rubbing. The use of paper towel may scratch the lenses. Also, alcohol is not recommended. It's not recommended not even to rub the lenses. The alcohol, it's not recommended because it may be too harsh, especially when the lenses have special coating. It has also been speculated that even appropriate hand washing does not eliminate all microbes and viruses from hands, suggesting that contact lens wearers remain at risk even with proper hygiene. So if this is true, studies have demonstrated that ethanol is excellent to inactivate human coronavirus. So disposable gloves or ethanol to disinfect fingers and hands before lens handling are reasonable procedures for an extra precaution. However, some concerns may arise. Patients may not dry their hands from ethanol properly before touching their lenses, or some residue from ethanol may remain on the fingers, transferring them to the eyes. So therefore, it's recommended to use ethanol for hand disinfection before hand washing. The alcohol solution will eliminate microbes and virus from the hands, and hand washing will remove all ethanol residue from fingers and hands. The other concern is the difficulty of applying the lenses with gloves. If the gloves are of the correct size, the ability of lens application wearing gloves will not differ from that without gloves. So last, realistically, we need to be true with ourselves. Contact lens wearer would not stop wearing their contact lenses. Instead of being of having a drastic veto on contact lens wear, clinicians should find this as an opportunity to educate patients on proper hygiene and the importance of compliance. Recently, CDC also clarified that there is no evidence that contact lens wearers are more at risk of getting infected. And also, CDC, this is very interesting, they provided information on contact lens care, suggesting the use of hydrogen peroxide-based system to disinfect contact lenses.
So there are many potential risk factors for infection, and Daddi, that's an excellent point that we can take this time to educate our patients. It's always important to educate our patients on safe contact lens practices, but now is an extra special time during the pandemic to go over, potential risk factors and how to make contact lenses more safe. So we talked about lens cleaning. If a patient, say, has 2 contact lens prescriptions, they wear soft lenses, they have one that's a daily replacement, they have one that's a reusable, now might be a good time to go to the daily replacement lens because there is no cleaning involved because the lenses are replaced daily. Appropriate hand washing, appropriate hygiene, not smoking. If you click one more time, Daddi, if you advance the slide. Of interest, male gender has been associated with potential risk factors for infection, but we know that contact lenses are quite safe. Even children can wear contact lenses very safely. It's the teenage to college age population that might have more risky practices. They might be around more people right now than other age groups, and they might have the potential to infect their contact lenses a little bit more than others. Moving on to the next slide. We know, especially now, there have been a lot of purchases of contact lenses on the internet during the time of the pandemic, where patients could not get into their doctors. Now, most practices in our area at least are open, but buying contact lenses on the internet, not always the correct contact lens prescription or the type, the actual type of contact lens is purchased. So these types of patients are more at risk for infection. Those who are new to overnight wear, I would not recommend sleeping in contact lenses at this time of the pandemic. I don't recommend it in general, but especially right now, we want to be as clean and safe as we possibly can. You just click the next slide, or click one more time. Great. Those who have high refractive error, of course, it's a lot easier to wear contact lenses and more convenient, but especially those who are very nearsighted or farsighted are potentially more at risk for infection. Swimming without goggles, that's something I talk to my patients about, because now that some pools are reopening, some patients are back to swimming, and it is important to wear goggles and making sure that the goggles are fit correctly so that water does not enter and touch the eye. Use while on vacation. And there are some people who are going on vacation, very few actually right now, but we know when we're on vacation, we might be a little bit more relaxed. We might not be replacing our contact lenses or cleaning them appropriately. So it could lead again to infection. And these are just, good advice in general. Next. And so one way that we could help right now is to switch to a daily replacement lens. There have been some reports in the media about silicone hydrogel lenses, that these patients are more at risk for coronavirus. That is not true. Some of the plastics that they're talking about are very thick plastic, not a very thin contact lens. We know the properties of a contact lens are quite different. So both silicone hydrogel and hydrogel contact lenses are safe to wear. And there are no studies at this time regarding the coronavirus and disinfection. So although the CDC did mention that hydrogen peroxide is safe, yes, it is. Perhaps the mechanical rubbing of a multi-purpose can break the cell wall of the virus. I think the main point is proper disinfection, so cleaning contact lenses every single night. And it will be interesting to see if there are studies that come out on what is the preferred method of disinfection. Next. The Tempo Registry is something to keep in mind, especially at this point in time, looking at both hydrogel and silicone hydrogel lenses. It was a large post-market surveillance registry, so a very realistic and practical survey. Next. And this looked at adverse events, including corneal infiltrative events in both silicone hydrogel and hydrogel lens wear over 1 year. Next. And it showed that the risk is actually very, very small. And yes, there's a very slight difference, 0.4% in silicone hydrogel and 0 in hydrogel daily replacement lenses. But if you have a patient who's coming in at this time wondering if they should wear a daily replacement or a reusable lens, you can go back to the Tempo Registry and say, the rates are actually really low of any adverse event with a daily replacement lens, and this could be a good option, especially during the time of the pandemic. Next. And the rates are significantly lower in daily replacement compared to reusable, which are 3 to 4% per year. So again, just being as safe, clean, and healthy as we can, especially during this time, is really important. Moving on to the next slide. So this is just looking at different studies. Again, smoking. So we know the risks of smoking for coronavirus in general. However, it could adversely affect contact lens wear and potentially lead to infiltrative events, purchasing lenses on the internet, some non-modifiable risk factors of interest, the high socioeconomic class. So during daily and extended wear, again, if we could just avoid extended wear or sleeping in lenses at this time, that would be ideal. Moving on to the next slide. Illegal contact lens sales in the US. This is definitely an issue that we are working on even this month. It is something that we continue to work on, and there are some reporting mechanisms to report illegal sales. So contact lenses are sold in various places illegally, such as gas stations or flea markets, or online without a contact lens prescription. So the two ways to report it is stop illegal CLs at AOA.org, and then MedWatch is another way to report the illegal contact lens sales. Next. We have a campaign every October to reach out to those who are selling contact lenses illegally, and fortunately have done quite well, where some of these businesses have actually gone out of business after sending the letter and reporting them. And this is through the AOA. I am on the Contact Lens and Cornea Council of the AOA as well. Next. MedWatch is just the other reporting mechanism. And moving on to the next slide. So important reminders to wash and dry hands prior to handling contact lenses and glasses. Let's avoid water altogether. No water. So no water on gas permeable lenses, no water on scleral lenses, no tap water at all. And some of my patients have been using water for years and years and years. And I have to remind them, one, we don't want to rinse lenses with water because of the risk of the acanthamoeba. Two, if there are special coatings on the lens, like tangible hydropeg, water's abrasive and it can definitely take off that surface coating. We want to replace contact lens solution daily, so not top off or add additional multi-purpose solution. And again, caution while swimming with contact lenses and wearing goggles. Moving on to the next slide. So important reminders for cleaning cases. So it is important to replace cases every month and replace accessory items like plungers for scleral lenses, and also to clean those as well. But how to clean a case? We want to rub it with a clean finger, rinse it with a multi-purpose contact lens solution, wipe it with a tissue, and store upside down in a clean and dry environment, which is typically not the bathroom, where many contact lens cases are stored. Moving on to the next slide. So the dry location is very important, and in not a humid area, so somewhere that is very clean and dry. But if in doubt, if a patient maybe thinks that they might have had an infection or are not sure, just replacing the case is always the safest option. Moving on to the next slide. There are many great resources that everyone can use. I think the CDC just has wonderful resources about safe and healthy contact lens wear. They're also creative, that contact lenses are like underwear, so you don't want to be wearing the same underwear day after day. And there are very good videos that you can share on your practices. And I would say all over the world, share these. And it's great because it's fun, it's humorous, and it's also really informative. Next. And this was the last contact lens health week about just the safe habits of contact lenses. So not sleeping in lenses, cleaning lenses, and making sure that you have adequate supplies. And I would say, if in doubt, educate our patients that it's important to have new plungers, new cases. We all have patients who have all these clean cases that they're not replacing. And if you can move and transition to a daily replacement lens to avoid the biofilm on a case and to prevent infection, that's definitely an option, especially at this time. Moving on to the next slide. So here are just some, and if you just click one more, some really helpful, safe practices for contact lenses. All of this information can be widely shared, but I would encourage you to talk to your patients and really get, their individual history and situation and how do they wear contact lenses. So for example, do they like to wear contact lenses every single day? Do they like to wear them occasionally? And if they have a lens that's not a daily replacement and they're wearing it occasionally, making sure that they're storing it in a multi-purpose solution, even if they are cleaning with a hydrogen peroxide, because we don't want a lens just sitting in that hydrogen peroxide solution for days or weeks on time. And also, it is so important to have glasses. Every contact lens wearer needs a backup pair of glasses, and also to carry the glasses with them and not to leave them at home. So if something gets under their contact lens or their contact lens dislodges or rips or whatever might happen, that they do have a backup, and that is a pair of glasses. Moving on to the next slide. And just again, just more helpful information that you can share with your patients and good ways to educate them that sleeping in lenses can really increase the risk of infection 6 to 8 times. And you can share this with your patients if they do tend to sleep in their contact lenses. And we want to keep contact lenses safe and healthy. We want our patients to have great vision, great comfort, and also great ocular health with their contact lenses. And it is possible to wear contact lenses safely, even during this time of the pandemic. Moving on to the next slide.
Yeah, it's nice. So we have to deal with different ophthalmic instruments we can use at a close distance. It has been demonstrated that droplets from cough and or sneeze can be propelled for up to 6 meters. So plexiglass barriers are essential to protect ourselves. To prevent infection, it's also crucial to achieve sterilization by 75% ethanol or hydrogen peroxide cleaning, or by immersion every ophthalmic equipment after each use, if possible. The use of chlorhexidine alcohol hand rub after each ophthalmic examination is recommended to prevent infection. Diagnostic contact lenses in trial sets should be properly disinfected after each patient. Personal protective equipment, including masks, gowns, gloves, and goggles, are highly recommended to prevent viral transmission.
And this is the updated in-office disinfection guidelines that will be published very shortly in OVS. And for example, for scleral lenses, it is important to place the lens in 3% hydrogen peroxide in a non-neutralizing case, so not a case that's ventilated, to disinfect for 3 or more hours, and then to rinse the lens with a multi-purpose solution and to store dry. Also recommended is a log of the contact lens disinfection date, the diagnostic case that the lens was disinfected, and the patient identification information. So yes, this is significantly more work. However, if a patient did have an active viral infection, for example, this is a way to go back and to know what lens was used. For example, if that lens was used on another patient, you could inform that patient as well.
So in conclusion, adequate hand washing with soap and water is imperative during ophthalmic practice, before and after every patient, even if gloves are worn. Clinicians should avoid touching their face, nose, mouth, and eyes. The process of hand washing should be extended to patients during consultation, and personal protective equipment are highly recommended. Practitioners should not touch their goggles, face shields, and face masks before hand washing. A further concern is the presence of SARS-CoV in tears and ocular surface membranes. So clinicians come in contact with these fluids daily. What to do? Gloves should be immediately changed after touching patients' eyes before touching any other surface like keyboards, computers, or other instruments. Thank you again for listening and for the invitation. It was such a pleasure to share with you this lecture.
Yes, thank you so much. And we'll open it up if there are any questions.
Thank you so much, Dr. Daddi and Dr. Melissa, for such a wonderful presentation. Well, now it's time for the discussion session to begin. I will be reading out the questions for you. Let me check out the queries that our audience might have raised. Are you ready to take the questions?
Yes.
Yeah.
Our first question goes as, what could be the second common complication after acute conjunctivitis due to corona?
May I clarify, is it an ocular complication or a systemic complication? What is the question?
Is ocular complication after acute conjunctivitis?
So as Daddi mentioned, looking at the studies, the rate of conjunctivitis, it's very low. And so when patients come in, it's actually more the systemic symptoms that I'm seeing, such as the fever. I'm not seeing other ocular findings. I'd love to get Daddi's feedbacks. I'm not seeing a higher incidence of corneal ulcers or iritis or any retinal problems at all. But Daddi, have you seen anything in our patients who have active infection?
No, I didn't see anything. And referring to the literature, the cases they had with conjunctivitis, the only thing that they had also red eye, even if they didn't have conjunctivitis. So the only important symptom and infection for the eye is conjunctivitis.
It's something that's a little related but unrelated is that people are more stressed right now at this time. And also people are wearing masks. Of course, we're wearing masks, our patients are wearing masks. And so I have seen more herpetic infections because of the stress levels. And I've also seen more hordeolum and styes. I think part of that is due to wearing the mask. Hopefully that answered the question.
Okay, thank you so much, doctors, for such a wonderful presentation. Doctor, I have one question. What could be the best advice after a patient having like COVID infection already and also have a ocular complication and they want to use the same contact lens after the COVID? So what could be the best advice that we can give to the patient?
I'm happy to take it, or you can answer, Daddi.
So you are asking what the advice if the patients have COVID, are positive to COVID and wearing contact lenses, is that correct?
Yes, doctor. Even they want to use after having the COVID and patient are using the contact lens, and after the recovery, if they want to use the same contact lens.
Oh, okay.
So what would be the yes?
When they are positive to COVID, like every disease, they have to stop wearing contact lenses until they have recovered from the disease. And once they recovered, they want to absolutely to wear other contact lenses. There is no problem, but not the same contact lenses. for soft contact lenses. If they are wearing rigid contact lenses like corneal lenses and scleral lenses, they have to disinfect them very well with peroxide solution, and follow the indication we gave in the presentation, disinfecting with peroxide, and they are safe. Melissa, I have a question for these people, for these patients that they were COVID positive. Would you recommend the same procedure that we are doing for our diagnostic set for rigid contact lenses?
Yeah, we definitely can. So ideally, I agree, if we could get a new contact lens, so whether it's a scleral, rigid, hybrid, or soft lens, just a brand new one with a new case and new solution, that would be ideal. But we could definitely do the extra disinfection. You know, it doesn't hurt to disinfect with that 3-hour hydrogen peroxide disinfection. Now, I think it would be safe for a patient who has recovered from an active infection to resume contact lens wear. But ideally, you know, as clean and safe and healthy as we can, that would be ideal.
Thank you for your answers, doctors. We have another question, and the question goes as, what effect will be there on eyes of corona warrior wearing contact lens during this pandemic?
So the question is, what is the advice for contact lens wearers during this pandemic? Is that correct?
No, doctor. What effect will be there on eyes of corona warrior? A person who is fighting with corona.
Oh, so if they're sick or ill, the advice is no contact lens wear at all. So discontinue contact lens wear.
Actually, ma'am, the question is, what effect will be seen on the eyes of the corona patient if he is wearing contact lens?
Okay, okay, doctor, can you please review the question on the chat box that I will just drop on the chat box?
Okay, so yes, so now I see the question, thank you. And so what is the effect on the eye if a patient is actively has a coronavirus infection? So they could be at higher risk of conjunctivitis, as the studies have shown. However, the rates were pretty low. There could be ocular irritation due to the contact lens. There could be potentially an increased risk of infection, which is why we do not want our patients to wear them. Also, the patient could be very tired and run down and sleeping, and then they would sleep in their contact lenses, which would further increase the risk of infection. Daddi, please feel free to add in if I'm missing anything here.
I agree. I don't have anything to add. Yeah, we don't have data on this, just what we are seeing in our practice. Yeah, it would be very interesting to know what more, where contact lens wear are having on eyes, the effect
Right.
on the
I
eyes.
haven't seen any studies at this time.
No, there's nothing on this.
Thank you for your answers, doctors. These are only the questions that has been raised by our audience as of now. We will be waiting for a few more minutes if anyone is willing to ask.
I'll ask Daddi a question because I'm curious how you're doing this in Italy. How are you addressing contact lens trainings during this time? So someone who's new to contact lens wear.
For soft contact lenses, we are giving their contact lenses directly without having any trials. So even if it will not be the last contact lens because of modification of the lenses, we threw the lens that they are trying and we get to new lenses. The same thing that we did before. So with self protection, equipment protection, and patients with masks, like the video I sent before with clear lenses. They wear masks, they wear gloves, and they try with their station. But after these trials, we need more time to receive the other patient, just to disinfect all the workstation where we had the trials. For clear lenses and corneal lenses, well, for corneal lenses, I already doing not having any more the trial set in empirical fitting. With clear lenses, I was doing this before the pandemic, and I was switching between empirical fitting and trial sets. Now I'm not doing any more with trial sets, only empirical fitting. And the education, the patient's education with clear lenses or corneal lenses, the same thing with soft lenses. They are trying with their own lenses, and they will take it home, and they will continue the education at home. We can reinforce also for these specialty contact lenses, we can reinforce the education with the chat.
Mm-hmm. Are you using a video chat or a telephone or a combination?
Yes, video chat.
Yeah. Excellent.
How are you doing in US? What is the procedure now?
For the training, we just have a large plastic barrier, so that's something that's new. And of course, the patient is wearing a mask, and our staff is wearing a mask in a separate room. But the barrier wasn't there before. Okay. And then agree with completely disinfecting all surfaces, really for everything. So all rooms. The difference also just practicing now is we're not rotating and moving patients. We're just keeping them in one room and then completely disinfecting that room when we're done.
Yes, a lot of disinfection after each patient.
Yes. Are there any more questions from the audience?
Thus far, these are only the questions, Doctor. I guess we have answered almost all the queries. Considering the time limit, here I announce the closure of discussion session. I would again like to express my immense gratitude towards our presenter and as well to all the attendees for their endurance. Also, I would like to thank all the direct and indirect helping hands for this iTalks program. Before wrap up, I request our today's presenter to share their few words to our program. Let's begin with you, Dr. Melissa.
Well, I want to thank all of you for having us. It's a pleasure to virtually be in Nepal. I hope one day to meet all of you in person. And thank you to Daddi Fadel, of course, for lecturing with me. It's always a pleasure.
Thank you so much, Doctor. It's our immense pleasure to have you with us today.
Thank you. Thank you so much for the invitation. It was such a pleasure and honor to lecture to students in Nepal, and I truly hope to get physically in Nepal and visit this amazing country. And of course, I thank Dr. Melissa Barnett for accepting to lecture. It was such a pleasure to lecture with you as always. Thank you. Thank you, everyone.
Thank you, Doctor. We truly hope to see you someday in Nepal in the near future.
Wonderful.
Hope so.
Okay, sir, do you want to add something before wrap up?